agency ay merong very, very rare, no? Kasi out of 200 million na mga nabakunahan ng AstraZeneca, meron po parang mga 16 cases, no? Na tinitingnan nila na possible connected nga po ng blood clotting tsaka yung pagbabago ng platelet. So we asked DOH na kung meron pa pong natitirang AstraZeneca vaccine, siguro ay huwag muna natin gamitin sa mga people below 60 years old until we get clearer evidence at saka clearer guidance from WHO tsaka sa atin pong mga expert.
That was Food and Drugs Administration Director General Eric Domingo announcing a pause to the use of AstraZeneca's jabs on vaccinees below 60 years old. This as health agencies look into possible links to blood clots.
But that's not the only pronouncement from the FDA today. It granted compassionate use permit to a hospital and a specific patient for the use of anti-parasitic drug Ivermectin. Good evening, I'm Gretchen Ho.
And I'm Robbie Alampay. You're watching The Big Story. Let's start with the European Union's drug regulator saying there is a possible link between the AstraZeneca vaccine and reported cases of blood clots.
With this, the Philippines health officials decided to follow other countries' move to suspend the vaccine's use for people below 60. Maricel Halili has the big story.
Several countries have halted the use of AstraZeneca vaccines, mostly in Europe like Spain, Italy, France, and Germany. The reason? Reports of blood clotting in some recipients. But as regulators stand by its safety and efficacy, many resumed its use. However, the European Medicines Agency has confirmed the vaccine's link to cases of blood clots, listing it as a rare side effect, mostly among women below 60. But there are no conclusions yet.
No specific risk factors could be identified based on the current data. The committee can therefore not recommend any specific measures to reduce the risk.
Here in the Philippines, there are no reported cases yet of blood clots from AstraZeneca vaccines. But the FDA is not taking chances. The regulator has suspected its use for those below 60 years old.
So we asked DOH na kung meron pa pong natitirang AstraZeneca vaccine, siguro ay huwag muna natin gamitin sa mga people below 60 years old until we get clearer evidence at saka clearer guidance from WHO tsaka sa atin pong mga expert.
Speaking on One News, FDA Director General Eric Domingo clarified that they only took this move out of caution and not because of serious safety concerns. He said those who received the jab should not be alarmed.
It's a very, very rare, unusual side effect. We just want to take a pause and then review all of the data so that once the new vaccines come in, the new batches, then we can be guided more accordingly.
Infectious disease expert Dr. Benjamin Ko emphasized that the recommendation of the shot was merely suspended and not its outright use. Ko also believes that it will not take long before regulators ultimately decide on the matter.
It did not say that it should not be used. So pending all other reviews, they're just suspending the its recommended use in the younger population.
The World Health Organization says experts and regulators are still studying data to come up with a clearer assessment. WHO is confident that AstraZeneca's benefits outweighs its risk.
We are confident that the benefits-to-risk assessment for the vaccine is largely still positive.
For News 5, Maricel Halili, we are One News.
The FDA has meanwhile granted a compassionate special permit for Ivermectin here in the Philippines, but there is something to make clear. Only one hospital is allowed to prescribe the drug for COVID-19 patients for now. FDA Director General Eric Domingo refused to disclose the hospital, citing privacy concerns. Domingo said other facilities have also expressed intent to use and distribute Ivermectin, but speaking on One News Now, Domingo clarified that the permit only allows the use of Ivermectin for a specific set of patients of an approved facility.
Compassionate special permit is very particular for the patients that they ask it for and for the hospital where it will use. So in case the hospitals need a drug, each and every hospital has to apply for it.
Hi, Robbie. Good evening.
Now, to help shed light on these developments, joining us on the big story is Food and Drug Administration Director General Eric Domingo. Yusek Domingo, welcome to the big story.
Hi, good evening, Robbie. Good evening, everybody. Thank you for having me.
Now, sir, let's start with this Ivermectin compassionate use authority. How wide or how narrow is the implication of this authority?
Well, a compassionate special permit is very particular. No? So the drugs that can apply for a compassionate special permit for COVID-19 would be drugs that are registered, for example, in other countries but are not available here, not registered here, or investigational drugs. And since ivermectin is actually an investigational drug, there are several clinical trials going on for its use against COVID-19. It does qualify. So what happens is a doctor or a hospital will apply for a particular brand that is already registered overseas. They ask for permission to import it, and then they use it on a list of patients that they will then report later on to the FDA, including what will be the outcome, what the outcome would be with these patients. So it's really very limited. It tells you the number of tablets that they can bring in, the number of patients they can use it on, and they have strict reportorial requirements afterwards.
Okay, so to be very clear, it does not mean na ang ivermectin is pwede na for general public consumption. You can't now just go to any drugstore or to your doctor and say, oh, legal na raw pala ang ivermectin for COVID. That's not it. And the other question lang po is, ano yung limitation in terms of time? Yung po bang authorization na yan para for that specific hospital, gaano katagal po effective yung authority na yan?
So ano yan talaga, hindi siya marketing authorization, no? I mean, they cannot sell it, no? You only give it to the list of patients. For example, if the hospital lists down 10 patients, then those 10 patients and how many tablets they need, yun lang yung kasama dun sa CSP. And if they list naman, for example, for use for 20 patients that are coming pa lang, we are usually allow them 1 year to finish. Pero na yung finite yung number of tablets that they can bring in, even though they can use it up within 1 year.
Okay, but what is the common denominator in terms of demographics or symptoms or conditions of these patients that can then petition their hospital to apply this to their case?
Well, usually it's cases of moderate to severe COVID, and then they base their dosage on the clinical trial that it's like getting access to clinical trial medicine, no? But without joining the clinical trial because you're not able to. So they also tell us the dosage that they're going to use it on the patient, and then like I said, they have to report to us also the outcomes on what happened to the patient.
Okay, now Yusek Domingo, very quickly, doon sa AstraZeneca naman, how long are we being cautious about this? Gaano katagal po before magkaroon ng linaw, whether here or on the international level, on whether or not AstraZeneca gets a universal green light again?
No, I think we're going to take maybe 2 weeks. I just want to ask the experts, our adverse event experts, our vaccine experts, and then the WHO. Kasi this is really the best time for us to take a pause. Kasi naubos na yung supply natin, Robbie, ng AstraZeneca. And then the next batch is probably coming in 1 month. And with this new data, and there's going to be some changes in the things that we have to watch out for, we just want to make sure we get all of the information so that we can prepare for the next batch before we start vaccinating again.
Maraming salamat po, Undersecretary. That was FDA Director General Eric Domingo. More people have been vaccinated against COVID-19 as the rollout of more than 2.5 million available shots continues. Tonight's big number, 922,898 total vaccines administered. More than 872,000 have gotten the first dose, while over 50,000 have already completed the 2 doses. The National Task Force Against COVID-19 reports that around 1.9 million doses have been distributed to some 2,600 vaccination sites across the country.
These are the other big stories tonight. Studies in the United States show increasing serious COVID cases among young adults. The same is being noted here by health experts, with some suffering what is called happy hypoxemia. Hashtag Nasaan ang Pangulo trended overnight over questions on the president's whereabouts and health. But officials closest to him clarify the chief executive is in good health. And pork stakeholders warn that supply may dwindle after the president signed an order lowering tariff on imported pork. These big stories are right after the break.
"25-year-old Rem and Javi is in isolation after testing positive for COVID-19.
Sumasama na yung pakiramdam ko at the end of my shift. Nagkaroon ako kasi talaga ng lagnat at that day, yung first day ko. Lagnat and ubo and like mahinang pakiramdam.
At the start of the pandemic, doctors initially thought that the disease affected mostly older adults, with the younger generation only getting a milder form of the disease. But experts are noticing a trend. The U.S. Centers for Disease Control said that in the U.S., people under 30 account for 20% of the COVID cases. In a study published by the Journal of American Medicine on 3,000 COVID patients, 21% of them ended up in intensive care. 10% were placed on a breathing machine, 2.7% died. The survey population was young, between 18 and 34 years old. In an interview with the chiefs, the College of Physicians Vice President Maricar Limpin also noted this trend.
Actually, ang parang pagbabago lang na nakikita namin, mas medyo madami kami nakikita ngayon na parang na medyo bata, walang comorbidities, walang sakit sa puso, walang diabetes, no, relatively healthy.
Yet another complication, what she calls happy hypoxemia, or COVID patients who appear to be doing fine even though their blood oxygen levels are getting dangerously low.
Hindi nila masyadong nararamdaman yung gravity ng problema nila na meron sila ngayon.
This condition can fool both patients and doctors into thinking that a patient is just having a milder form of COVID until everything crashes.
Alam namin anytime pwedeng mag-deteriorate ang condition nila.
For Rem, there are days when his condition really gets bad, surprising considering his young age. Because of these new trends, Dr. Limpin warns people not to take even mild cases of COVID for granted, with many COVID-19 patients frightened to visit a hospital and arriving only when their symptoms have dangerously advanced. Doctors also wonder whether home monitoring could hasten treatment and whether for some that could make all the difference. Stanley Gahete, We're One News.
The distribution of financial aid, or ayuda, to those affected by the stricter lockdown is now underway. But with LGU slapped with a 10-day deadline, several beneficiaries have to wait for hours out in public, under the sun, and even beyond curfew hours. JC Cosico tells us more.
Residents of Barangay Batasan Hills in Quezon City had no choice but to endure the summer heat as they patiently waited in line to claim their so-called ECQ ayuda from the national government. Others were seen wearing their face shields improperly, and physical distancing was hardly implemented.
Atras, 1 meter tayo, 1 meter. 1 meter. 1 meter po, hindi po tayo.
Jonela Dilaran arrived at the QC University at around 5 a.m. to secure her spot. But after almost 6 hours,
Andito pa kami, bilad na kami rito para na kami tuyo at saka isda rito.
the payout in Barangay Batasan Hills was delayed as the distribution yesterday lasted till this morning. Officials implemented a clustered scheme distribution, resulting in beneficiaries flocking to the payout center. Wilfredo Salgado waited for more than a day as he opted not to go home anymore to secure his spot.
So wala pa kayong kain? Tiniis na lang namin kasi sa uwi pa malayo. Masakit ang baka kasi PWD.
For Jesselie Duenas, the money is badly needed as her husband's job was affected by the ECQ reimposition.
Kailangan mo talaga kumapit sa patalim na kumbaga balyahan na to.
Following these hiccups, the barangay has decided to distribute the aid alphabetically.
Kaya po doon sa mga kasama natin o kaibigan natin na hindi letter A ang kanila unang apelido, tuloy na po muna tayo.
Barangay officials have also tapped the police not to apprehend beneficiaries who will stay in line during curfew hours. They aim to finish the distribution of ayuda among around 59,000 beneficiaries in 10 days. For News 5, JC Cosico, We Are One News.
These are the other big stories tonight. Malacanang assures the public that President Duterte is in good health. Speculations on the president's health condition rose after the palace postponed his weekly address to the nation. A senator close to Duterte posted a recent photo of him in response to concerns. The United States warns China over its continuing presence in the Julian Felipe Reef. U.S. State Department spokesman Ned Price says Beijing's armed attacks could force the U.S. to provide support in case of aggression. Foreign Affairs Secretary Teodoro Locsin Jr. meanwhile once again calls on China to withdraw its ships from the country's waters. Transportation Secretary Arthur Tugade has ordered the swabbing of all railway personnel. COVID-positive workers, their close contacts, as well as those exhibiting symptoms, have been directed to immediately isolate. Because of this, Metro Manila's railway systems will be operating at a limited capacity. Time for another quick break. More big stories when we return. Keep it here on One News.
You're still watching The Big Story. I'm Robbie Alampay. An executive order has been signed lowering tariffs on pork imports for 1 year. How will this affect the country's hog industry? Shaila Francisco tells us.
The 60-day price ceiling on pork and chicken products across Metro Manila is set to end today. The government will instead start imposing a suggested retail price on imported pork. SRP for imported kasim will be at 270 pesos per kilo, while SRP for liempo will be at 350 pesos per kilo. The Agriculture Department says this will cover imported pork being sold in supermarkets and wet markets. Retailers are appealing to the DA to also implement an SRP on local pork, but the DA does not see this happening for now.
Para ma-adjust konti yung presyo na within range na hindi malugi ang local aggressors. Ang cost structure dito sa aming analysis ay nasa 320 to 350. So meaning dapat maglalaro yung presyo ng local pork.
In line with this, President Duterte has signed an executive order temporarily lowering tariff for pork imports for a year starting today. Meat processors welcome this, saying that this will result in more affordable prices of processed meat products in markets.
Pwede natin kausapin so itong mga importer, alam natin kung anong puhunan niya, more or less. Pwede natin kausapin ang trader, sasabihin po natin, ito dito lang patong nyo, wag yung sobra-sobra. At pwede natin kausapin ang palengke.
Agricultural groups warn that local supply will dwindle as backyard raisers may be discouraged to produce hogs, while commercial farms may resort to importing supply instead. Hog raisers are also accusing the DA of going easy on importers by giving them higher margins and imposing an SRP instead of a price cap.
Na ang pumapatay sa sektor ng magbababoy, sektor ng agrikultura, ay ang matindi hindi yung ASF Yang ASD, Agriculture Secretary Dar, lahat ng kanyang ginagawa parusa sa mga magbababoy. Kaya dapat yan tanggalin, mag-resign, mahiya.
The Senate will conduct a probe on Monday to examine how tariff cuts will impact the food security and to determine possible revenue losses. Shaila Francisco, VR1 News.
Here are the other big stories on print and online. From the Philippine Star, the Health Department says cyclists and other active transport users are not required to wear face shields due to potential safety risks. The DOH stresses that face shields must still be worn before and after cycling. This clarification comes after a report that a doctor in Cainta was arrested on his way to work for not wearing a face shield and resisting arrest. The country's trade gap in February widened as imports increased and exports contracted. Business World reports that merchandise imports grew to 2.7%, the first time in 22 months or almost 2 years. PSA data, meanwhile, showed that exports declined by 2.3%. And this from News 5, Meralco consumers will be seeing a slight increase in their electricity bills this month. This as Meralco raises its rate by 0.0872 centavos per kilowatt hour. For households with a monthly power consumption of 200 kilowatts per hour, that amounts to an increase of 17 pesos. Meralco attributes the hike to higher wholesale electricity spot market charges. Pilipinas President Al Panlilio to procure vaccines for national athletes. The POC is eyeing to vaccinate those who will represent the country in the Southeast Asian Games. Business tycoon Enrique Razon earlier promised that Olympic-bound athletes will be inoculated by late May or early June. The budget for the procurement of vaccines will come from a $40,000 subsidy from the Olympic Council of Asia.
And age does not matter. This is certainly true for COVID vaccination. A centenarian from Las Piñas has received her first jab. Tomasa Amurao, or Nanay Po, got inoculated with AstraZeneca at 101 years and 4 months old. Nanay Po was accompanied by her grandson, a city doctor. Her grandson said she did not feel any pain or side effect, although Nanay Po had 3 words on the experience: matalas ang karayom. Las Piñas LGU urged residents to follow her example to defeat COVID-19. Kaya ni Lola, kaya nating lahat.
Diba? Nakakatawa naman. That gives me confidence for my dad and my mom. No, but in other news, my brother got his second dose today, and other healthcare workers are getting their second doses after a month of being inoculated. So,
And beyond frontliners, marami na tayong nakikita ngayon sa social media, di ba? Mga may comorbidity. So if you can register, if you can get a slot, go ahead and get it. The more of us get it, the better for all of us.
That's right. Well, that wraps up today's big story. Catch us again tomorrow on Signal Channels 8 and 250.
Please like our Facebook page, One News. For more in-depth analysis, visit our webpage, onenews.ph.
Mask on, wash hands, and stay safe, Philippines.
And stay negative. Be positive. Kaya natin to. Ako po si Robbie Alampay.
Ako naman si Gretchen Hall. We are One News. Have a good evening.